But now that it's Thursday morning out of the 8:30 news, we have a feature we like to call What's Up, Doc. We've been doing this for months now with our friends at Mercy Health, where we get a fine professional from there to stop by and hang around with us a little bit. We get to ask some questions, learn a few things, and the doctor generally walks away thinking to themselves, well, what did I do to deserve this?
So mad at Trish for this one.
How did I draw the short straw and have to talk to those guys? Well, hopefully that only happens like 1 out of every 2 interviews. But, we're working on our averages. This morning, we're going to talk a little bit about your skin. Now, winter months, tough on skin, especially here in the Midwest. So joining us to talk about that is Dr. Ashish Taneja, who is a dermatologist at Mercy Health. Dr. Taneja, good morning to you.
Good morning, folks.
How are you?
I'm doing well. You guys?
We have nothing to complain about.
Well, I do, but not to you. Right
Yeah, nothing that you'd be interested in hearing. Let's put it that way. Hey, tell us a little bit about you.
Sure. Born and raised in Chicago. I spent my college years at the University of Illinois at the Urbana-Champaign campus.
Good choice. ILL.
Yeah, you got it. Finished up medical school at Chicago Med, and then completed a residency in dermatology from the state of Michigan. Came back to Chicago about 10 years ago, where I've been running a practice in the medical district in Chicago. And about 4 months ago, we partnered with Mercy Health and came out here.
And how do you like it out here so far?
I like it, actually. I didn't know that this area was referred to as Forest City. I enjoy all the greenery and all the nature. It feels therapeutic for me when I come back here.
Nice. Are we? Is our skin better than the folks in Chicago overall? Just go ahead and say yes.
Yes, absolutely.
Good to know.
I like to dig into our guest undergrad experience. What was your freshman dorm down at U of I?
I stayed at the Illini Tower.
Oh, wow, fancy. Very nice. They had the best meals.
They did have the best meals.
Yes, they did.
Okay. Well, nice that you two can draw this accord on the culinary aspects of U of I. It's good. I like hearing this a lot. All right. What made you choose dermatology?
I pursued the specialty for a few reasons. I enjoyed the daily variety that I would have in my clinic. I could be seeing a medical patient, doing a surgical procedure with the next patient, a little bit of cosmetics, even reading my own pathology slides. So I enjoyed that variety. I also like the fact that I could, treat patients of all ages, from a 1-day-old to a 101-year-old. I'm very visual, so I enjoy looking at when my patient comes in and they're complaining of a certain issue on their skin. I like the fact that I can see it, visualize it, and put my hands on it and try to help them with that. And then with that being said, it allows me to hunt for skin cancers, which are by far the most common cancers affecting humanity today.
Yeah, all right. Let's get to the big boy. Skin cancer. What do we need to be looking for? What should alert me to go schedule a visit with you?
The 2 biggest flags would be a spot that's just not healing, something that just should have healed by now but hasn't healed, or a mole that's changing, becoming symptomatic. Any of those 2 things, we would want to know about it.
When you say a spot that shouldn't be healing, you're talking about like a nick, a cut, something like that?
Yeah, a nick, a cut, or, sometimes these skin cancers start off as what looks like a little pimple. A lot of people call them a pimple. Most times pimples will heal in a few weeks, but if this pimple is not healing and it's getting bigger, then we consider that not healing.
Along the lines of skin cancer, because, it won't be long before we're in that season where, we're getting hit with sunblock advertisements every time we turn around. Mm-hmm. Give us the definitive on this one, because if we were to Google it, we get 500 different answers. What's a good SPF for an average person?
So the way I look at SPF is essentially the higher the SPF, the less often one would need to reapply it. So suppose you and I go outside in the middle of a summer day, and you have on SPF 30 and I have on SPF 110. After about an hour and a half to 2 hours, the SPF 30 really has worn off, versus the SPF 100, 110, assuming that you didn't go into water or sweat it off, you're still good for about 6 or 7 hours. So that's why I tend to look at the SPFs.
Okay, because, some of them I look at, you see SPF 30, you see SPF 50. Yeah, like you said, I saw one that was SPF 150, and right. I found SPF 100, that's like wearing a bee suit. But it's actually more about how long it takes for it to wear off.
Yeah, that's exactly right.
So if the SPF essentially is just about the length is it on, does natural pigmentation of people's skin, those with more melanin, darker skin, do they? The thought I always thought was the darker your skin, the less SPF you had to do, but that if it's just time, that's not correct, right?
Yeah, that's correct. I mean, I have the more pigment you like. The way I look at it is my skin tone is a bit brown. So I've always said, like, I've got like an SPF 5 already built in.
Okay.
You know, and you can take it from that. But yeah, because I have a little bit of pigment, or because someone has more pigment than another, we still recommend wearing sunblock for all skin types.
I was going to say, I was roommates one time with a guy who would actually, you know, get a sunburn from a 100-watt light bulb. He was that fair. So,
Yeah.
you know, I think he was looking for the stuff that you would literally apply with a primer coat and then put SPF over the top of it without knowing exactly it was more length of time than thickness of SPF. But everybody should wear it. Now, is that all seasons? Because it's not like the sun isn't out now reflecting everywhere. You'd put sunglasses on if you're outside.
Yeah, no, that's a good question, actually. Yeah, we recommend using sunblock actually indoors and outdoors 365 days. And the reason why is because it could be the most gloomy day, but radiation is still passing the clouds and reaching our atmosphere. And we also know that light from fluorescent bulbs and other light spectrums can also affect our skin.
Oh, so even if you're not heading outside.
Yeah, right, exactly. Especially if someone's trying to address an issue with discoloration, trying to improve sun-damaged skin. You know, we always say use your sunblock indoors and outdoors. And we're also getting some data now that the screens from our telephones, if we're putting the phone next to our ear and talking, the radiation from the screen scene can also affect the skin of our face.
Another reason not to go on Twitter.
Oh, yeah. I was gonna say, wow, I didn't think paranoia was going to set in quite this early for me in this interview, but it already has now. All right, I'm going to have to get an assistant to handle my phone for all things. I want to protect myself on this one. What is this type of weather, winter weather, especially this deep freeze we're just dragging ourselves out of? What does that do to your skin?
Sure. Yeah. When the temperature drops, there's less moisture in the air just because the temperatures drop, which means a decrease in humidity. Now, if it's a windy day, then the wind is going to strip more water from our skin, or if we're indoors just because it's super cold outside and sitting in front of a fire, that's also going to take more water from our skin. So all those combinations of variables coming together in this season makes our skin lose a little bit too much water, which is what we call dry skin.
And that's why I'm super itchy in the winter, because that's happening, and I'm not smart enough to properly apply lotion at regular intervals, right?
Yeah, how about I just share some tips on how to improve dry skin?
You can go ahead and agree with him, too. That's all right.
But yeah, so, you know, moisturizing is one of the key options that we have to improve dry skin. The best time to really lather up really is immediately after we wash. So after you hand wash, after you hop out of the shower, it's best to use a moisturizer that's gentle, unscented, ideally with some ingredient that you look for called ceramides that actually puts the oil back in our skin so our skin can hold on to water better.
You mentioned unscented for the lotion. Is that for cosmetic reasons, or are those not as effective as scented or as scented lotions?
So essentially, suppose your skin is already dry and you went off and put a scented moisturizer on there. That scent, being an additional chemical, could add gas into that irritation that you've already gotten from the dry skin. So we try to take away any additional gas from going onto our skin, and that's why you recommend fragrance-free cleansers.
If you're just joining us, spending a few minutes with Dr. Ashish Taneja. He is a dermatologist at Mercy Health, and we're getting some of our questions answered about winter weather and SPFs and other things. Just as a side note, I see these commercials all the time that, you know, and they're primarily targeted toward women. Oh, you'll try this lotion. You need this lotion for your face because this will bring back that youthful bounce. This will get rid of wrinkles. This will. How much of that stuff is on the up and up? And I don't want you to name any names, but how much of it's on the up and up, and how much of it is pretty much bunk?
You know, the quality of these moisturizers are improving over time. A lot of these newer moisturizers will add a good amount of tone and improve the texture of the skin. But when they start to promise things like, you know, removing wrinkles and all that stuff, I'd be a little cautious.
Okay. I'm not worried about that quite yet. Vanity hasn't hit me to that level, but you know, in 10, 15 years, I might want to get rid of some of those wrinkles.
So, other than the skin cancer flags that we talked about, what other reasons should I come see you for an appointment?
Sure. Yeah. So, making sure there's nothing suspicious on the skin. Anytime the skin is inflamed, there's many different reasons why one skin gets inflamed. We can address all of those issues as well. And then let alone the whole cosmetic realm of, trying to make the skin look younger for folks.
So, yeah, it's one of those things that I think people forget about how important skincare is overall. I want to make sure I get the right amount of vitamins. Am I getting enough fiber? Am I eating this? Am I drinking this? But, then skincare is like, well, I took a shower. What am I supposed to do something else?
Sure, yeah, okay. So let me, for example, let's talk about some tips about when we take showers and baths, especially when our skin is dry. So during these months, when you're hopping in the shower, make sure you close the bathroom door to keep that humidity in that room for you. Instead of using really hot water, stick with warm water. Limit your time in the water. Less than 5 or 10 minutes is ideal. Don't overdo it with your gentle cleanser. Apply enough to remove the dirt and oil. But if you do too much, or the lather is too thick, you may be taking away some more oils from your skin. Hop out of the shower. Take a towel that you washed with a sensitive skin or a scented-free detergent. Pat dry your skin. So leave a little bit of water on your skin, and then just generously apply moisturizer from head to toe to lock that moisture in. You can also consider wearing a lip balm because the lips do get dry pretty well in the wintertime. When you go outside, the hands is one of the most common locations where our skin to get dry. Wear gloves. If your hands are going to get wet, put some gloves on before you get your hands wet. If you're going to work with chemicals and greases, make sure you protect your skin. When you're indoors, when it's cold outside, sitting in front of a fireplace can definitely make your skin get dry faster. And then also consider sticking a humidifier in your environment.
Go back to the shower experience. Any soaps to avoid or gravitate to? Or what about your abrasive cleaners, with microbeads and whatnot?
Or you got a loofah?
Yeah, something like that. What's your recommendation to clean up?
Okay. The best analogy of how our skin works is we have skin cells and we have oil in between our skin cells, kind of like a brick and mortar analogy, where the brick are our skin cells, our mortar are the oils in between our skin cells. Now, I'm sure you guys have washed dishes before, and you take like a greasy pan and you squirt some dishwasher soap on there. You notice how that grease just gets stripped away, right?
Yeah.
So that's what the definition of a soap is. It strips away any kind of grease or oils. So the soaps that all of us have been using are essentially stripping away the mortar of our brick and cells, our skin cells. So we strip away the oils from our skin, the water is just about to follow that. So that's when the industry established a word called cleansers, gentle cleansers. Gentle cleansers still help cleanse the skin, but they don't strip away the oils that our skin needs. And with regards to the loofah, a lot of us consider that to be like a bacteria hotel, especially if you're keeping it in the shower where it's still staying moist and wet. If you do wish to use that, I would recommend that you keep it out of the shower, let it dry every day. Make sure you disinfect it as well, or really just use your palms to apply the cleanser on your skin.
Yeah. Bacteria Hotel just said to me, chuck it. Not clean it. Just get rid of it. But I'm reactionary when it comes to things like this. I think, there's a lot to be learned from Dr. Ashish Taneja. For people who would like to make an appointment, get together, talk things over, how do they get in touch with you?
Sure. I'm at Merce Health Galleria. We're at 7402 East Riverside Boulevard in Loves Park. They can call us at area code 815-971-3920, or even make an appointment online at mercyhealthsystem.org.
Outstanding. Dr. Taneja, thanks for carving time out of your schedule for us. This was very informative, and we appreciate it.
Yeah, you got it. Thanks for having me.
No problem.